Hello everyone, welcome to episode 2 of the cold, flu and COVID management series. So in this episode, we're diving straight into the treatment protocols and we're kicking off with looking at the primary antiviral herbal medicines we should be using at the first sign of infections, looking at why we should be using them and looking at how we create a multi-herb prescription that gives us the best of all worlds. So when managing viral infections, whether that's COVID, whether it's seasonal flu, whether it's bronchitis, whether it's viral throat infections, whether it's just a common cold, whatever it may be, it's so important to hammer home the significance and the importance of taking a multifactorial approach. And the reason that's so important is that the way viruses proliferate, the way viruses survive, the way viruses are so effective at creating these systemic infections through the body is that viruses don't just use one pathway to ensure their survival. They use multiple pathways that allow them to attach to cells, that allow them to penetrate cell walls, that allows them to proliferate within the cells, that allows them to maintain their life cycle. And that's true of all viruses, but it's particularly true of COVID. One of the hallmarks of the COVID virus is that it's a systemic infection. It affects virtually every cell within the body within reason. It affects the heart, it affects the circulatory system, it affects the respiratory system, it affects the lymphatic system, it affects the kidneys. It affects so many different areas of the body. One of the reasons for that is because it's got these multiple viral pathways, and because it has these multiple pathways, it necessitates the need to use multiple treatment approaches so that we're for every viral pathway that the virus uses, we've got a treatment to cap that, to intervene against that viral pathway. And because of that over the course of this series, we'll be looking at the primary treatment pathways, the primary multifactorial pathway we need to be intervening with and using to address these different viral mechanisms. But the obvious place to start is to actually focus on the antiviral herbs. That's the obvious place to start. And viruses are interesting. Viruses are phenomenally effective. They are so clever. If you appreciate them from the objective standpoint, viruses are miracles because there's nothing else on the planet that is as effective as ensuring its own survival as a virus. And viruses are almost on the edge of life because they're not alive like bacteria. Bacteria is an individual life source. It's a living entity. Whereas viruses aren't. Viruses are on the edge of what it is to be alive because viruses don't have cell walls. Viruses aren't able to sustain life or replicate on their own. They need a host. They need a body to invade, and they need to use the cells of that body to allow them to replicate. And during viral infections, whether it's a low-grade common cold or whether it's a full-blown acute COVID infection, the success of the virus and therefore the success of our ability to treat and suppress the virus is primarily dictated by inhibiting the mechanisms by which the virus attaches, penetrates, and duplicates within our cell walls. And that makes life a little bit tricky because we're not treating a bacteria which is active in the body. We're trying to treat an invading pathogen that's actually replicating within our cells itself. They're actually living inside our cells. And that's one of the reasons why herbal antivirals are so important, because herbal antivirals, any antivirals as a medical intervention, they don't kill the virus. They're not viricides. They don't kill the virus. What antivirals do, including herbal antivirals, is that instead of killing the virus, they cap or they inhibit the mechanisms by which the virus attaches, penetrates, and proliferates within our cells. And by suppressing those mechanisms, we limit its ability to replicate, which means we shorten its lifespan, which means we speed up how quickly we clear the infection. And how do we do that? Well, the way that viruses attach, penetrate, and proliferate within our cells are myriad. There's, there are so many pathways that viruses use, but the evidence is very, very clear. If you look at COVID, and this applies to most respiratory viruses, so whether if you fall prey to a bad cold, if you fall prey to viral chest infections, if you fall prey to seasonal flu, if you fall prey to COVID, this is largely going to hold true for all of those, because the mechanisms that COVID uses to invade our cells are very similar to the mechanisms that other viruses use. So whilst there are many pathways and many mechanisms, by far the most important three, which is what the Western pharmaceutical drugs are trying to target, which is what the antivirals are trying to target, it's where the research is strongest, is three areas. The first one is using treatments that are specifically antiviral for the SARS virus, so the SARS group of viruses. So these are the core antiviral herbs that help to suppress the proliferation and replication rates of the virus in our cells. That's the first one. The second one is we need to use treatments that affect and modulate something called ACE2. So ACE2, we'll cover this in more detail shortly. The ACE2 are the linkage sites that COVID and other viruses use to physically attach onto our cell walls. And it's obvious that blocking that mechanism is absolutely essential, because if the virus can't, actually dock onto or latch onto a cell, it's not able to sustain its life cycle. So anything that blocks that ability is profound. And we also need to help support the health of the ACE2 receptors, because the ACE2 receptors are essential for the health of the organ they're found in. So if our ACE2 receptors diminish and weaken in our lungs or in our heart or in our kidneys, then the health and the functionality of those organs diminish, which is why we're seeing in COVID this long-term heart damage, the shortness of breath, the kidney damage. It's because of the damage to the ACE2 receptors. And the third thing we need to do is we need to regulate cytokine activity, because during these acute infections, our body releases massive volumes of these cytokines, which cause gross inflammation, which cause damage to our organ systems, and in severe cases can cause wholesale organ failure. So the mechanisms we're looking at in this episode are how can we use herbal medicines to target each of those three pathways, because if we target those pathways, then the evidence suggests we're doing as much as we can to suppress and inhibit the ability of the COVID virus to replicate and sustain its life, and thereby we speed up how quickly we clear out the infection. So like I said, to do that, because there's three pathways, we need to use a variety of different mechanisms. And if we just use one herbal medicine, if we just use high-dose echinacea or high-dose elderberry or high-dose andrographis, all of which are very strong evidence-based herbal medicines, we're definitely going to get a clinically significant benefit, because we know that those herbs suppress the ability of viruses to dock onto our cells. But if you use those individual herbs on their own, they're not going to target all three of those pathways. They might not regulate cytokine activity, or they might not suppress or modulate ACE2 or whatever it is. But if we're using there's no single herb that's going to tick all three of those pathways. So the reason we're stressing and emphasizing the need to use a multi-herb complex prescription is because by doing so, we tick all of these pathways. But it comes with the caveat that if you can't get all of the herbs, and you've only got elderberry or you've only got andrographis, then by all means use that. Using a single herb is infinitely better than not using it at all. Okay, so before we dive into the mechanisms themselves, I just want to briefly talk about some of the cost implications here. Because we base these protocols on the best available evidence. We based it on the best available evidence. There's been an explosion of research into the assessment of herbal medicines against COVID. And what we're presenting here is an unadulterated and overview. We're not watering it down because it would be unethical to do that. And that by default necessitates the need to buy several individual herbal medicines, because we're formulating these multi-herb prescriptions. And that is expensive. There's no getting away from it. The herbal medicines aren't cheap. Where possible, we've tried to provide a cost-effective option, which has excluded one herb from the prescription if possible. But that does come with a slight reduction in efficacy and effectiveness because of that removal. And my old professor at, when I was working at Southampton, and my mentor, when we were involved in cancer research and herbal medicine research, his words were always, it's not so much a case of whether we can afford to buy the herbs or the supplements or the complementary medicines. It's more a question of, we can't really afford not to, because what are the financial implications? What are the medical implications, the social implications of getting an infection that's unmanaged? The cost of the latter is usually far greater than the cost of the former. Most people have been financially affected by COVID. And I appreciate that, spending 50, 60, 70, 80, 100 pounds on herbal medicines, isn't ideal. But I think we will reap the reward of that tenfold by protecting ourselves. But it's just important to emphasize that we're presenting this as the best case option. We're not watering it down. Okay. So across this series, over the coming episodes, we'll be looking at 3 individual tinctures, so 3 individual prescriptions alongside a herbal tea or a herbal infusion. So the first tincture, which we're talking about tonight, is using the antiviral herbs. The next episode is going to be looking at a tincture, a prescription to manage and support our immune health and our lymphatic health during an infection. The third prescription is going to be a herbal tincture to support the functionality and health of our heart, our lung, and our endothelial cells. And then the singular infusion or the singular tea is looking at how to alleviate the symptoms of an acute infection. So we don't want to be using one of those or 2 of those. In the best case scenario, we want to be using all 4 of them concurrently, because the evidence tells us we need to attack the antiviral pathways, which is prescription 1. We must support our immune and lymphatic health, which is prescription 2. We must protect our heart and lung and endothelial cells, which is prescription 3. And we do need to alleviate symptoms, which is the infusion. So each of those will be covered in the subsequent episodes. But tonight we're diving in with the primary antiviral herbal medicines. So the first prescription that we want to have ready-made, blended, bottled, and stored in our home apothecary or in our medicine chest at home is the primary antiviral acute tincture, which is made up of 4 herbs in uneven ratios. And those 4 herbs, and we'll talk about why we're using them in a minute, are andrographis, licorice, Bakel skullcap, and elderberry. And if you're trying to cut back and you want to save some money, then you can remove one of those. You can remove one of those, the licorice, by using andrographis, Bakel skullcap, and elderberry. So if you're using the full prescription, then we want andrographis to be 40%, so the biggest proportion, and then 20% each for the licorice, the Bakel skullcap, and the elderberry. And the reason for that is we're using Bakel skullcap in one of the other prescriptions, which will top it up, and 2, because andrographis has really jumped into the fore at the moment in terms of the antiviral mechanisms against COVID specifically. So to make that prescription, you need to buy those individual herbs in 1 to 3 strength, which is what most of them are. You can get them from Baldwin's. You'll get an email which overviews where to get these herbs. You can get them from Baldwin's, you can get them from Indigo Herbs, you can get them from Napier's. So you get your andrographis, you get your licorice, you get your Bakel skullcap, you get your elderberry. They're all in liquid. They're liquid herbs. They're tinctures, and you blend them in those ratios. So you for every 100 mils, it's 40% andrographis, 20% licorice, 20% Bakel skullcap, and 20% elderberry. You need to give that a really good shake. And we'll talk about the dosing in a minute. We also need to be taking ashwagandha at 2,000 milligrams a day. It's taken as 2 500 milligram capsules in the morning and 2 500 milligram capsules in the evening. And we also want to be using bay laurel essential oil diaphragmatically every 2 hours, but I'll cover that in more detail in a minute. But why are we using these herbal medicines? So the first thing, ACE2 modulation. This is so important. It's where the evidence is perhaps strongest around COVID, because there's two things we need to be aware of when managing an acute infection. We firstly need to modulate and protect our ACE2 receptors, because, like I said earlier, doing so is essential for maintaining the functionality and the health of the organ in question. So that's important. But the most important thing is the second point, is that you can see in that picture there, the SARS virus on the left with the pink spikes, the human cell on the right, and in between those, you've got those claw-like yellow ACE2 receptors. And for the virus to penetrate into our cell wall to allow it to survive, the SARS virus has to dock into an ACE2 receptor. That's its gateway into our cells. If we're inhibiting that mechanism, if we're blocking it, if we're putting a receptor block in the way, if the virus can't physically attach to the ACE2 receptor, it can't get into our cells. And there's compelling evidence that the herbs, I put an asterisk there by ashwagandha, because there's very clear evidence that ashwagandha is phenomenally effective at suppressing the ACE2 linkage. It's proven to block the docking of COVID, the virus, into the ACE2 receptors. Angiographis does it, Bakel skullcap does it, licorice does it, and elderberry does it. So in the antiviral prescription we're using, every single one of the herbal medicines that we're taking in that complex prescription will help to suppress the mechanism by which the COVID virus docks onto the human cells via the ACE2 receptors. So that's the first justification for using those herbs. The second justification is that we need to regulate cytokine activity. And this is essential, particularly as the symptoms and the severity of the infection get worse, because during these acute infections, whether it's COVID or a bad seasonal flu, it causes massive inflammatory responses within the body. It causes mast cell death, something called apoptosis, and those mechanisms, as the virus is proliferating and spreading, the body, to compensate for that, increases these massive doses, massive volumes of cytokines, which are peptides, and they're essential for the immune system to work properly. Without cytokines, we couldn't exist. They keep us safe. But during these acute systemic infections, our body can produce too many. And the more severe the infection, the more it produces, which means the worse we become. And the upshot of that is many and varied. There's huge implications in lots of areas of having too high a level of cytokines circulating in our body. But one of the main things it does is that cytokines make our cell walls more porous. It makes them easier for the virus to penetrate. And that has a very significant impact upon speeding up how quickly the virus can grow and spread through the body. The second thing that we need to protect against is that as cytokine activity increases, it can very quickly affect the health of our organs by affecting the cells in those organs and damaging those cells, which means our organ function drops, which, like I said earlier, which is why there's such shortness of breath, which is why there's long-term heart damage, why there's long-term scarring in the lungs. It's why cytokine activity is a key mechanism for that. And then just as importantly, the third key component of why it's so important to regulate cytokine activity is that cytokines in excess levels, they inhibit the production and growth of key immune cells like our T cells. And those T cells are essential for attacking the virus in the body. So as the virus is spreading and cytokine activity is increasing, it's suppressing the very immune cells that we need to kill the virus. And that obviously means that there's more capacity for the virus to grow, and there's less immune-based attack of the virus, which makes it easier for the virus to grow. So the bottom line is that we need to regulate cytokine activity. If we've got any chance of coming through a COVID infection with no long-term organ damage, no systemic problems, no long-term COVID, we need to regulate cytokine activity. And what's interesting is that there's already research showing that two key forms of cytokines, called IL-6 and IL-8, if we can protect and limit the production of those cytokines, we know now that that results in less severe symptoms. We know it results in less acute infections. We know it results in quicker recovery times. But there's lots of research showing how herbal medicines can play a very key role in regulating and controlling and modulating cytokine activity. And in the context of the herbs in this prescription, Angiographis is phenomenally effective at regulating cytokine activity, particularly IL-6. Bakel skullcap likewise, but again, ashwagandha has really almost jumped to the top of the pile in terms of this multifactorial protection against COVID. You know, it affects all of the viral pathways, it inhibits all of the viral pathways. It's a mandatory herb, which is why we're using it in isolation. So the third key reason why we're using these herbs, why we pick these herbs, is because of their ability to inhibit and suppress the main mechanisms that the virus, the COVID virus or the common cold or the seasonal flu virus uses to ensure its penetration, replication and proliferation within our cells. And this is probably where the evidence is strongest, because there is research going back decades now showing how a handful of herbal medicines are clinically proven to suppress viral proliferation rates. Not obviously all, you know, COVID based, but there is so much research looking at echinacea, looking at elderberry, looking at angiographis, looking at ashwagandha. We know that they block viral proliferation pathways, and it does that in lots of ways. Some of the herbs neutralize the virus as in itself. Some of the herbs suppress its ability to dock onto our cells, not just through ACE, but also through other mechanisms. Some of the antivirals increase the immune targeting accuracy. There's so many ways that they do this, and that's the benefit of herbal medicines, because, you know, herbal medicines aren't pharmaceutical medicines. If we're using a pharmaceutical medicine, we use drug X to treat viral pathway Y, and that's all it does, and that's good. But herbs are multifactorial, and there's not one herb that just addresses one viral pathway. You know, herbs, if you look at elderberry, if you look at ashwagandha, if you look at Bakel skullcap, it's able to suppress viral growth along different pathways. And that's a real strength of herbal medicines, in that any given herb will address multiple pathways. And the ones, you know, in terms of the herbs that suppress that viral proliferation, again, all of the herbs do that. Angiographis, I put in an asterisk there because it's probably, looking at the research around COVID and how it's unfolded, particularly over the last 3 or 4 months, Angiographis has definitely leapfrogged into pole position in terms of its actual ability, the chemical constituents found in Angiographis and their ability to suppress the proliferation of the COVID virus is very, very robust. Bakel skullcap does it, licorice does it, elderberry does it. And also one other treatment that's not in the prescription, which is the use of the bay laurel essential oil, which is proven now to inhibit the docking of COVID-1 and COVID-2 into our cells. And we have to be using bay laurel essential oil. It's essential if we're managing an acute infection. So how do we use these herbs? So I guess the most important takeaway message from this episode is that, you know, hopefully as soon as possible after watching it, you know, in a couple of days or a week, you can open up your home apothecary, your medicine chest, your herb cupboard, and you want a pre-blended tincture, you want ashwagandha capsules, and you want your bay laurel essential oil ready to go in an acute COVID box, which you only open at the first sign of infection. Not just COVID, seasonal flu, colds, bronchitis, anything. So the tincture, like I said, you need to buy 200 mils, 250 mils of each of those individual tinctures. So I put a picture there of Baldwin's. We've got no affiliation to Baldwin's. You can get it from Baldwin's, you can get it from Indigo Herbs, you can get it from Napier's, like I said. But that is a picture of a 250 ml bottle of Angiographis tincture in 1 to 3 strength. So you need one of those for Angiographis, one of those for licorice, one of those for Bakel skullcap, and one of those for elderberry. So you've got your 4 herbs. What you need to do then is to get a sterilized jam jar or a sterilized medicine bottle, which again you can get from Baldwin's, and you fill that bottle, you fill the empty bottle up with those 4 herbs in those ratios. So, you know, for every, if it's a 200 ml bottle, you'd put in 80 mils of Angiographis, you'd put in 40 mils of licorice, 40 mils of Bakel skullcap, and 40 mils of elderberry. You put the lid on, give it a really good shake so it all blends together. And at the first sign of symptoms, that's the other key thing, it must be at the first sign of symptoms. If you wait 12 hours, 24 hours, 36 hours, then you're drastically reducing your success rates, because every hour you leave it, the virus is proliferating. You need to start straight away, which is why you want to have this in ready. You don't want to be ordering this when you're symptomatic. You need to have it ready to go at the first sign of symptoms. And this is the acute prescription. So it's 2.5 mils every 2 hours from waking to bedtime. So from 7 or 8 in the morning until 7 or 8 or 9 in the evening, 2.5 mils of the combined blend every 2 hours. And that's an acute dose. The other tinctures, the other prescriptions we're talking about in the subsequent series, they don't use that dose. They use a less aggressive dose. This is an aggressive dose because it's the main antiviral. So 2.5 mils every 2 hours. The second thing we need to be doing is we have the ashwagandha in the cupboard. We take 2 500 milligram capsules in the morning. We take another 2 500 milligram capsules in the evening. That gives us our 2,000 milligrams a day. That's essential because ashwagandha is an all-encompassing anti-COVID herbal medicine. It's really gaining huge traction at the moment. And the last thing you want to be doing is the bay laurel essential oil. In 2008, there was a COVID-1 outbreak. COVID-19 is often called COVID-2 because it's a second COVID outbreak. Bay laurel essential oil was one of the most effective ways of reducing the proliferation of COVID-1 in the lungs in humans back in 2008. COVID-2 or COVID-19 is 96% the same as COVID-1. And that led researchers to say, well, if bay laurel was that effective for COVID-1, it must be pretty much the same for COVID-2 or COVID-19 because it's 96% the same. And they researched that and it seems to be just as effective. It seems to be almost mandatory that we are saturating our lungs with the vapor of bay laurel to inhibit the docking of the virus into our lung cells. Okay, so all you want to be doing is a very strong essential oil, 2 or 3 drops into a big bowl of hot water, not boiling water, big towel over their head, and diaphragmatically breathing, not shallow breaths. We want to be saturating the lungs, the full volume of the lung with that vapor. So deep diaphragmatic breaths to fill the entire lung capacity for 10 minutes, 5 to 10 minutes, depending upon how unwell you feel, performing that every 2 to 3 hours. So, 3, 4, 5 times over the course of a day. So that's the first treatment. That's the first treatment pathway. This is the antiviral pathways. And based upon the evidence, there's always different opinions. There's always things you can add in or take out. But based upon the evidence, based upon the reading, everything that we've been able to get our hands on and all the research we've ordered, to my mind, that is the most effective, on the evidence, the most effective herbal prescription plan for targeting viral proliferation rates in human cells. The tincture, the ashwagandha, and the bay laurel. So order those in. They're very easy to get online. So just quickly, some contraindications. So the first thing to emphasize is that if you're pregnant, if you're breastfeeding, if you have any liver disorders or any kidney disorders, if you're under medical supervision, then make sure you check with us before using these prescriptions to make sure that they're safe to do so. But if you haven't got liver dysfunction or liver disease, you haven't got kidney disease, you're not pregnant or you're not breastfeeding, the chances are these herbs are going to be incredibly safe as long as you're aware of the following points. So Bakel skullcap, you shouldn't really be using it if you're on blood thinners like warfarin, because Bakel skullcap can thin the blood. It's also a strong herb. It's designed to be used for short periods of time, so to manage an acute infection. It's not to be used as a preventative. It's not to be used long term. But other than that, it's very safe. Angiographisce, because it's such a powerful immune stimulant, it shouldn't be used alongside drugs that suppress the immune system. It shouldn't be used for if you've got autoimmune diseases and if you're taking autoimmune drugs, because obviously if you've got drugs that are aiming to reduce the immune system, angiographisce is going to increase it. So they're in conflict. But that said, the general consensus is that it's fine to use these herbs along in those situations, as long as it's only for a short period of time. So if you've got rheumatoid arthritis or you've got lupus or any given autoimmune condition, you can use angiographisce for 10, 14, 21 days, because it's probably not going to be in the body long enough to worsen your symptoms. So for managing an acute infection like COVID or flu, we find from past experience of managing viral infections that people with autoimmune problems don't get a worsening of symptoms as long as they're not using it for more than that short period of time. But if you do have an autoimmune condition and you do take it and your autoimmune conditions get worse, then obviously stop taking it. And that applies for elderberry as well. But Bakel skullcap, angiographisce, and elderberry are incredibly safe. We've used them for decades in managing viral infections. We've never had or seen any adverse reactions or side effects. Licorice is one to be aware of because it's a very strong herb. We don't want to be using licorice long term, and we definitely don't want to be using it at a high dose. It's a synthesizing herb. It's used as part of a multi-herb prescription. So we use it in lower doses in combination with other herbs. But you absolutely unequivocally must not use licorice if you've got high blood pressure. If you've got high blood pressure, if you're on blood pressure medications, completely take it out of the prescription. Okay. Likewise, if you've got heart rhythm issues, if you've got problems with low potassium, if you're taking laxatives regularly, don't use licorice, completely remove it. Okay. And then lastly, ashwagandha. There's some theoretical concern about not using it alongside thyroid medication, but that's not backed up or supported by the evidence or by the science. We've never had a problem. Okay. So generally speaking, obviously, if you start them and you notice any symptoms or side effects, then stop taking them and contact us. But in reality, they're incredibly safe herbs. They're very well tolerated. Using them this is an acute treatment, for, like I say, 10, 14, probably maximum 21 days. And that they're not going to cause problems over that period of time, because there's not enough time for them to cause a problem. Okay, as long as we're taking into account the fact that you're not pregnant, breastfeeding, or don't have liver or kidney disease. But if you have any questions, then please do contact us via the Facebook page or the email, and we'll do our best to advise and support. So that's the first treatment pathway, the antivirals, the most important one. So please, 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 if you're looking to protect yourself, order those herbs, make up the tincture, get the ashwagandha ready, get the bay laurel essential oil ready, so you can intervene at the first sign of treatment. That is the biggest thing to emphasize. You need to be able to use it at the first sign of symptoms. Get that ready. If we do that, if we use them very quickly, the evidence suggests it's going to have a very big impact upon suppressing the mechanisms that the virus uses to proliferate and grow. In the next episode, we're moving on from the antiviral pathways, and we're looking at how we support our immune system in attacking the virus and how we support our lymphatic system and protect it from damage. We look at why it's so important to do so. We look at what herbs we're using. We look at their safety profile and contraindications, and we look at the second prescription, the second multi-herb complex prescription, and the dosing for using it for supporting our immune health and supporting our lymphatic function. So I look forward to going through that with you in the next episode.